Member for Cumuto, Manzanilla.
Thank you, Madam Speaker. Madam Speaker, I rise to take part in this, my fourth budget debate as a member of this honorable House. I must congratulate the leader of the opposition in her response, fantastic response, on this budget statement 2024, as well as my opposition colleagues who spoke previously for their outstanding contributions. So before I start, I just want to do some rebuttals from my colleague from Toco Sangre Grande. The first one is the indoor sporting facility, and it has taken 8 years, and I'm very hopeful that the people of Sangre Grande can actually get an indoor sporting facility, because it seems that, again, this government is always about rural neglect. Secondly, you mentioned about agricultural access roads, and I pray and hope that this comes to fruition, because in my tenure so far, we have little or no access road for the farmers to get to the crops, to take out the produce, and that has been a challenge throughout the constituency. Thirdly, you must remember during the floods, we have water everywhere, but none in the taps. I await to see the North Urupuch investment plan for water, how it will work and transfer into water in the taps for the people for Cumuto, Manzanilla. You mentioned as well 111,000 persons will benefit from the new Sangre Grande Hospital, which the Minister of Finance said would open the first quarter. Please do your policies and procedures for the hospital and ensure there is proper and adequate medical staff to be sourced, because as mentioned by the member, the opposition leader from Siparia, we have little staff to go around. I was hoping my colleague again would speak about the disaster in the constituency, both in Toco, Sangre Grande, because as you know, fully aware that the disaster management unit is under-resourced, and many times many people are marooned. And although you did not mention it, that is a sore point in that area of the peninsula. And finally, we have heavy trucks that do quarrying and logging, some legal, some illegal. And it's time that there's a weighing station in Sangre Grande, because without that, whatever roads that you're building with taxpayers' dollars, those roads are being destroyed. And I start, budget after budget, year after year, Madam Speaker. This government comes to this House promising to fix our roads, increase capacity in our health system, improve our water supply. In Proverbs chapter 29, verse 2 tells us, when the righteous are in authority, the people rejoice. But when the wicked rule, the people groan. And I assure you, there is a lot of growing across the nation when the ministers, voluminous for our presentation, groaning. Today, all anyone can talk about, Madam Speaker, is the fact that in 2023 is turning out to be just as violent and bloody as 2022. People are talking about their inability to get jobs. They are talking about how terrible the roads are. People are talking about their empty water taps. People are talking about the high price of food and gas. People are talking about what a burden the new property tax will bring and the proposed increased electricity rates and water rates. This PNM government has failed in its duty to keep us safe. They have failed to provide the necessary goods and services that we depend on as tax-paying citizens. And I have heard nothing in the minister's budget presentation gives me hope that anything will change for the better. But as the psalmist said, weeping may last for the night, but joy cometh in the morning. And come 2025, The sun will rise over this land when a new UNC government assumes office. And we will bring back transparency, accountability, and people-centered governance to this nation. Madam Speaker, I will start with health. Budget review. In examining this budget, the Minister of Finance, I note that despite the 600 million increase in allocation into the Ministry of Health, there is a 267.4 million decrease in recurrent expenditure allocations to the regional health authorities, specifically to the Northwest Regional, Central, and Southwest Regional Health Authorities. And they have slashed the operating costs of the Cuba Hospital by almost 50% compared to last year, from 66 million in 2023 to 34 million in 2024. And I ask why? Why are you decreasing funds to those critical frontline agencies? Our hospitals and health centers are routinely under-resourced and the staff are overburdened. The global 19 pandemic just finished and our staff are burnt out. Clearly, healthcare for the average citizens is not a priority for this administration. Special needs sensitization. Recently, the unfortunate experience of a family, a special needs child, Madam Speaker, traveling aboard a Caribbean Airlines flight from Tobago, captured the attention of the nation. The father of a 3-year-old autistic girl recounted how an interaction between a flight attendant and a child triggered an incident on board a flight. If anything, Madam Speaker, this highlights a critical need for a sensitization and public education program on engaging what special needs individuals, especially in state-run agencies and departments. More resources are needed to make diagnosis, therapy, and education of persons with special needs more accessible and affordable. And I was most disappointed to note that such necessary interventions were not a priority on this government's policy agenda. Mental health care. We all recall the situation involving allegations made against a private mental health treatment facility that was raided by the police in 2019. But the case was recently dismissed due to lack of evidence. That case triggered critical conversations, Madam Speaker, about the care and treatment of people suffering from mental illnesses. Persons with mental health diagnosis must be accorded the rights and privilege due to them as citizens of this country. Certain mental illnesses are difficult to manage, as the patient can manifest a violent behavior that may cause them to become a threat to themselves and others. However, care and treatment of such individuals must never be an affront to their dignity as human beings. Their illnesses are not their fault, and they must always be treated by the most qualified medical professionals and housed at approved facilities that are properly equipped to effectively treat their conditions while maintaining their dignity as human beings. Again, I am disappointed that the minister did not prioritize care facilities specifically designed for persons coping with serious mental illnesses. I would like to see more support for families of individuals with mental illnesses. We need to prioritize our most vulnerable citizens who are in need of specialized medical care. Blame game and broken promises, Madam Speaker. Madam Speaker, the Minister of Finance had used the COVID-19 pandemic to be the reason why the economy and even the health sector has been in shambles. However, now that we have come out of the pandemic, the question to ask is, what will this PNM government blame for the state of the economy and even the health sector now? For it is that the PNM led by the Rowley government that has brought us to this situation, and even prior to 2020. In 2016, the government, which in this same PNM government, indicated that it will review the existing hospital strategy through a scientific, evidence-driven hospital construction and refurbishment plan, and where necessary, we will refurbish and modernize our existing aging plant and will construct new health facilities where they are required. I will expand on this further down, Madam Speaker. The government, through the Minister of Finance, indicated they will expedite surgeries and expand and improve the Chronic Disease Assistance Program, formerly called CDAP. Also, they will continue with medical aid programs for patients in need and review and audit the Children's Life Fund. Yes, the Children's Life Fund, a brainchild of the member for Siparia. Fantastic job. So as to restore its mandate of saving the lives of children. Further to this, Madam Speaker, in 2017 and 2018, this same government, through the same Minister of Health, promised to ensure sustainable funding for the healthcare system by collaborating with private sector investors through private-public partnership. And I must ask this question, was this really achieved? In 2019, the government boasts of upgrades taking place at the St. James Medical Complex, the St. Anne's Hospital, the Port of Spain, and San Fernando Hospital, as well as Cora and Sangre Grande. The 504-bed central block at Port of Spain General Hospital will be commissioned in 2024. But the Minister of Finance comes this year and says, we are on track to complete the construction and commissioning of the new 540-bed central block and Port of Spain General Hospital in March 2025. So what is really going on here? I will lead that information to my colleague who will go more into the hospital system. Now, Sangre Grande Hospital. I listened to the minister mention the government put in a 106-bed Sangre Grande Hospital at a cost of 1.1 billion, which is nearing completion. As I said, what my colleague said about Toko Sangre Grande. The hospital will have a full range of services, and I pray and hope that it will be commissioned early. In the 2019 budget speech, Minister of Finance Colin Imbut stated that the new Sangre Grande Hospital will be scheduled to begin construction in 2019 on an expedited basis, utilizing the model for the Point Fortin Hospital. So in the 2020 budget speech, the Minister of Finance again came and they said they secured funding for the hospital. This hospital is needed, but let's hope that it comes on track in 2024. Now, in the 2022 budget speech, the Minister of Finance again stated that the Sangre Grande Hospital is coming at full pace. The sum of 65 million will be provided to complete the construction of the new Sangre Grande Hospital. Madam Speaker, I want to tell the Minister of Finance and by extension the Minister of Health that constituents from Cumuto, Manzanilla complain on a daily basis on a lack of beds, on a lack of doctors, a lack of medication, and a lack of nurses. So it is true that once you make these promises about the new hospital, please let it happen. Medical staff. Now, as I indicated, Madam Speaker, there has been a lack of doctors, nurses, and hospital staff. Before we continue, we need to know about our nurses. Our nurses are the pillars upon which effective, efficient, and safe healthcare is delivered to patients. They are leaving continuously, Madam Speaker, in droves, being coerced by international recruiting agencies. They're looking for better salaries, remuneration, further education and training. They feel unsafe with all this crime that's taking place, and they want a better life for their families. You know, before, when these recruiting agencies, Madam Speaker, came, they waited for these nurses to train for experience. 3 to 4 years afterwards, Madam Speaker, as soon as they graduate, they come to take them. So very soon, our general nurses and specialized nurses will be in a rarity. Now, the same thing is happening to our junior doctors. You're giving them 1 month, 2 month, 3 month contract. That's happening for a year. That is no tenure of employment. So very soon, the more hospitals we have, the less staff we will have. So you'll have 1 nurse or 2 nurses managing 40 to 50 patients. That is reckless clinical management. But having said that, we've mentioned a lot about hospital. But I tell you, in terms of non-communicable disease, the way to go for healthcare, according to the World Health Organization, is primary health care. It is most inclusive, cost-effective, and efficient approach to enhance people's life physically, mentally, and social. So now that we have put that together, there's a term we use, non-communicable disease. The reason why I say this is because from the budget, the minister says there is little to none on the chronic disease program. Madam Speaker, I must remind the minister and the CDAP program is highly used by persons suffering from NCDs. And I tell you, many people never use, as a physician, never use the CDAP program. A lot of the middle class people who have lost their jobs, they're using it. And you'll be surprised what they're asking for. Madam Speaker, a healthy nation is a wealthy nation. And great emphasis should have been placed on NCDs, particularly among the teen population moving to early adulthood. As a practitioner, it's difficult to change the mindset for older persons, but we have to start at the younger ones. And this is where the Ministry of Health comes now in focusing on fostering health education and health promotion. It is critical that a comprehensive education campaign be initiated so that at an early age, persons are educated and warned about the dangers of non-communicable disease, such as heart disease. Heart disease is the #1 killer we have in this country and the rest of the world. Stroke, diabetes, cancer, asthma, chronic obstructive pulmonary disease. Madam Speaker, the expectation is that having the knowledge today will be beneficial in the future in avoiding the cases of such ailments, so that large chunks of the budget will not be spent in finding a cure, purchasing medication, but be used in prevention. Incidentally, Madam Speaker, we are seeing now from all the research that's coming out worldwide that young persons are having fatal MIs, fatal heart attacks. From the age to 25 to 44, we've seen a 30% increase. 45 to 64, a 25% increase. And over 65, a 20% increase of fatal heart attacks. And these people do not have non-communicable disease. Younger people under 50 are dying, they're getting cancers. So the thing is, it has to do with chemicals in our food. It has to do with stress and other mitigating factors. According to the World Health Organization, the non-communicable diseases, NCDs kills 41 million people each year, equivalent to 71% of deaths globally. Each year, Madam Speaker, 15 million people die from NCDs between the age of 30 and 69, and over 85% of these premature deaths occur in low and middle income countries. Cardiovascular disease, Madam Speaker, accounts for most NCDs, or 17.9 million people annually, followed by cancers, 9 million, respiratory disease, 3.9 million, and diabetes, 1.6 million. I am thankful to be alive. And the onus for every one of us here, and everyone here, take care of your health. These 4 groups of diseases account for over 80% of all premature non-communicable diseases deaths. Tobacco use, physical inactivity, the harmful use of alcohol, unhealthy diets, all increase risks of dying from NCDs. Just at the point with unhealthy diets, you find now that there is something called ultra-processed foods, UPF. And unfortunately, 58% of calories that adults ingest comes from ultra-processed foods, UPF. And 67% of the calories on children comes from the same. So these are more likely to trigger off cardiac disease, diabetes, hypertension, cancer, and obesity. And these are like fizzy drinks, soft drinks, snacks, cakes, biscuits, potato chips, packed soups, pasta, sausages, chicken nuggets. We are killing our children because that's what we give our children to eat, and adults are consuming it as well. So health is not a bottomless pit. So that means you're going to build more and more hospitals, and that's why I say the tenet of management of healthcare is to keep focusing on primary health care. As I continue, Madam Speaker, people of all age groups, regions, and countries are affected by NCDs. Children, adults, and the elderly are all vulnerable to the risk factors contributing to NCDs, whether from unhealthy diets, as I just indicated, physical inactivity, exposure to tobacco smoke, or harmful use of alcohol. You know, just to mention that with the online learning we had during the COVID pandemic, so those young people growing up now, we have found that there has been an increased use of smoking and alcohol use and abuse. And of course, the psychosocial stress that has gone with that. Madam Speaker, NCDs threaten progress towards the 2030 Agenda for Sustainable Development, which includes a target of reducing premature deaths from NCDs by 1/3 in 2030. Madam Speaker, poverty is closely linked with NCDs. The rapid rise in NCDs is predicted to impede poverty reduction initiatives in low-income countries, particularly by increasing household costs associated with healthcare. Vulnerable and socially disadvantaged people get sicker and die sooner than people of higher social status, especially when they are at greater risk of being exposed to harmful products such as tobacco or unhealthy dietary practices and have limited access to health services. Now, Madam Speaker, today is a very significant day. Today is the 6th of October, 2022. Today is World Cerebral Palsy Day. And under the People's Partnership, during the 2010-2015 tenure, many of the parents and guardians of children who had cerebral palsy, they got a grant of $800 to assist, especially with the rearing of these children and the medical service. And many of these children had to still continue as adults on formula, on milk, basically. So I'm asking and pleading with the government if this could be restarted, please. And my question to ask to the other side is, what is the status of the National Enrichment Center, which is for disabilities at Carlson Field? So at the same time, there is another program called the EPP, which is the Extended Patient Care Program. This is a specialized testing and procedures for those persons who cannot afford such as angiogram, dialysis, cataract surgery, stents, open heart surgery, joint replacement, vitreoretinal surgeries, etc. The only problem with this, these are expensive procedures, and some of them are complicated, Madam Speaker. And the people who really need it, unfortunately, they are oversubscribed. They have to wait a while, and more often than not, they die. And it's a reality what happens. I wish we could do more, but you know what? Let's hope in 2024 more could be done as we question the Minister of Health to see what could be done. And I know my colleague will talk about the cath lab for San Fernando Hospital. As I continue, Madam Speaker, it's important to control NCDs to focus on reducing the risk factors. Low-cost solution exists for governments and other stakeholders to reduce the common modifiable risk factors. Monitoring progress and trends of NCDs and their risks is important for guiding policy and priority. To lessen the impact of NCDs on individuals and society, a comprehensive approach is needed requiring all sectors, including health, finance, transport, education, agriculture, planning, and others to collaborate to reduce the risks associated with NCDs and promote interventions to prevent and control them. Invest in better management of NCDs is critical. Management of NCDs includes detecting, screening, treating these diseases, and providing access to palliative care for people in need. High-impact essential NCD interventions can be divided through a primary health care approach, just to repeat myself, to strengthen detection and treatment. Madam Speaker, I raise these issues as highlighted by the World Health Organization to demonstrate that coming out of the COVID-19 pandemic, there are lessons that must be learned. And that's what the opposition leader, member for Superior, was talking about. What would you learn from COVID-19 pandemic? And your next question to ask is, what if there's another pandemic? What do we have in place for such? And that is very important. The idea, Madam Speaker, is to be proactive in the delivery of health care. This country, with all of its brilliant human resources, cannot afford to adopt a reactive approach to its healthcare system. We must always be one step ahead. As medical professionals, we have to be one step ahead because life always hangs in a balance. We know about today, but we don't know, none of us know about tomorrow. I can tell you that I practice in an area where NCDs are the highest, that is in central Trinidad. We have the highest amount of diabetes, amputations, hypertension, cardiac disease, and fatal MI in one area. And I will plead with the government, please look at developing a hospital in central Trinidad, and especially focusing in primary health care. I'm sure my colleague from Shogunas West would love to hear that. I am today calling this government, when they build a hospital, there is land that was earmarked by the partnership government in Shogunas for such, something like 8 to 10 acres of land. As I continue, Madam Speaker, the Minister of Finance in his last budget had indicated that cancer screening escalated from 24,495 in 2015 to 54,163 in 2020, an increase of 121%. However, in this budget statement, there's little to none mention about cancer care in this country. And as I display my pink ribbon on my jacket, we have to be reminded for our ladies that's Breast Cancer Awareness Month. And if a woman lives long enough, 1 in 8 women will develop breast cancer at some point in time. Where we go back, primary health care again. Madam Speaker, from the mouth of the Minister of Finance, it took a pandemic to make this government invest in hospitals to be taken urgently. Therefore, Madam Speaker, I say it again by his own admission, had it not been for the pandemic, we may not have seen the commissioning of Arima Hospital, the Point Fortin Hospital, and the Couva Hospital and multi-training facility. As I continue, Madam Speaker, I want to remind the Parliament and the Minister of Finance that in the 2021 budget, the statement to my display, the Minister of Finance, the freezing of employment persons for 1 year. I am asking if this still continues or this has to be rectified in a way so that we can have proper staffing at our health facilities. And I have a question for the member for St. Joseph. In terms of the Chemistry, Food and Drug Division, are they testing pharmaceuticals? The reason I'm asking that, there's so much counterfeit medication in the pharmacies, in the private pharmacies, Madam Speaker. So people are realizing they're using the same medication, but the hypertension and diabetes is not being controlled. So the afforded testing needs to be done. Now I will focus on agriculture, move away from health. Madam Speaker, any discussion boosting the agricultural sector in Trinidad and Tobago must take into account the constituency of Cumuto, Manzanilla, and an area that is predominantly rich in agriculture. It is blessed with land, labor, capital, and human resources. The constituency holds tremendous potential for the area, as well as the national community. And we can remember all too well with the market boxes, most of it came from the river swamp, where we have over 400 farmers. So an allocation of 1.442 billion in the sector is simply not adequate for agriculture. My colleague from Cuba North will continue on agriculture. Madam Speaker, agriculture is our new oil and gas and should be seen as a revenue generator for our country. Madam Speaker, only a couple of weeks ago, I had the privilege of seeing firsthand the operations at Mapa Farms. Now, it was mentioned in the budget. Mapa Farms is a propagation unit. And before, what happened? They employed a lot of young people from the community in propagation and budding. Now that has ceased. And with having youth and bringing that, according to what has been said, what we need to do is to bring them back into the system. They'll become young entrepreneurs in farming. But here's the problem with Mapa Farms. They have all these exotic fruits, dwarf coconut trees, avocados, bananas, all the mango trees you could think about exotic. But the problem is, you wouldn't believe Mapa Farm has no running water and they have agricultural officers there. The place has limited funding, so right now they can't even fix their own tractors. They have no working ACs. The road to go to Mapa Farm Access Road is deplorable with lots of caving. So if we are really serious, Madam Speaker, about agriculture, we need to spend the money where it needs to be spent. Madam Speaker, under the People's Partnership, what we did, as I said, about budding and grafting, we need to do that, because if you're serious about the farming, here what we're going to do. We're going to get people from all areas to learn about budding and grafting and make that area, ship them, use Mapa Farms, and they can actually learn a skill. Madam Speaker, the minister came hot and sweaty this year with rehabilitating 240 kilometers of access road. Well, Madam Speaker, whatever happened to the access road repair program was supposed to commence in 2022. Remember the promises. It will cover 80 kilometers and provided relief for over 400 farmers. Cost 75 million. These areas include Matlot, Toko, Manzanilla, Sandy Grande, and other areas. Where did the $75 million go, Madam Speaker? How many times are we going to hear the PDM say they're going to deal with road repairs for agriculture? Madam Speaker, just the other day I visited one area between the Manzanilla district, and the road was a total mess. You couldn't go with a car at all. You had to go with an SUV, a 4x4. And imagine the farmers. They complain that they don't have any access road. Madam Speaker, the Minister of Finance mentioned in the previous budgets the productive Plumita area, which is in the constituency of Cumuto, Manzanilla. And 11 million was committed for the replacement in 2022 for the decade-old pumps, as well as access road repair. This has not borne fruit, and this is 23-24 budget. Madam Speaker, these pumps need repair. Right now in the river swamp, you're supposed to have at least 400 farmers. When I visited there, what I was told by the farmers, there are only 34 farmers. With the extensive dry spell, there's little water in the irrigation channels. So what that means, we talk about the market boxes. Many farmers have abandoned production. The reason being, when they were decimated in the floods of November 2022, they have not received any compensation, and they cannot afford to do farming. On top of that, with the extensive dry season, they have no water. Whoever is remaining, God bless those farmers for the heat that they work in. Everything is more expensive, the transportation, the chemicals. So what if we are again very serious about agriculture? We have to do what we have to do to help farmers. Now, who I met was with one of the rice farmers. It's a new project by the Ministry of Agriculture. It's called Revitalization and Modernization of the Rice Industry. So, Mr. Farmer, he was doing 300 acres in the river swamp, and I think 150 acres to be done in Caroni. This is phase one of 1,200 acres. My question is, when I asked the farmer, who is processing the rice, all that he told me that the rice will be taken by national flour mills and it may be used for dog rice because they're not sure what will happen. But we wait to be seen. At least we're doing something with rice. Madam Speaker, while we speak of agriculture, we must also extend the conversation to livestock rearing, as well as fishing, as the constituency is bounded on the eastern seaboard by miles of sea, rich in fish and other seafood waiting to be commercially and profitably exploited, as we have many cascadoo, tilapia, conch, and major fishing villages as well. The best conch you get is from Bish. You must remember it was a PNM administration which literally abandoned the sector in the last 5 years of governance and is now suddenly realizing the value and significance of the sector. We must throw our minds back to the closure of Caroni 1975 Limited and all its attendant agricultural products, citrus, buffalo rearing, Caroni Green, all which met their demise under the watch of this government. Stories of farmers having their crops stolen at night. We need a prettier larceny department in that area. Madam Speaker, I stood here last year and spoke about this. I won't go back to this again. To date, Madam Speaker, none of this has borne fruit in the sense that the farmers say, listen, hear what? You're going to steal my crops? I'm not going to plant anymore. So we're doing everything to detach the farmers from actually doing a livelihood, an honest livelihood. I want to turn to flooding. Flooding, whether due to heavy rainfall or rising river levels, pose a significant threat to our farmers and food security. When farmers are inundated with water, crops are not only destroyed, but the fertile topsoil is often eroded away, making it difficult to cultivate for a future crop. This not only leads to immediate financial losses for our hardworking farmers, but also disrupts the food supply chain, resulting in increased prices and food shortage for consumers. Furthermore, livestock can be at risk during floods, and the damage to infrastructure like irrigation systems and storage facilities can further compound the losses. Madam Speaker, it is crucial that we invest in better flood management and mitigation strategies to protect our agricultural sector, support our farmers, and ensure food security for our nation, not food insecurity, food security. Where are the measures to protect these hardworking farmers and the havoc that these floods wreak on their livelihood and produce? I wish to draw attention to a critical issue plaguing our agricultural sector, is lack of secure land tenure for our farmers. My colleague from Couva North will go more into that. It fosters a climate of uncertainty when it affects our food production, when our farmers turn away, and some of them are older, they retire, and when the young ones decide this is not what they want to do. So who's going to grow our food? Our farmers face tremendous challenges due to poor roads, inadequate irrigation systems, and outdated storage facilities. These deficiencies not only increase the cost of production, but also result in substantial post-harvest losses. Madam Speaker, I've been having consultations with the CEO of NAMDEVCO, and what I was told is that Trinidad and Tobago, like many other countries, there is something called food loss and food waste. Food loss, agricultural food loss, is from the harvest to retail, and from when the consumer have it to retail, or when you use it or don't use it, is food waste. And we waste a lot of food. And because of that, those same food as waste is thrown in the garbage, gone to landfill, and guess what happens? That's greenhouse gases. So we want food, and many people are starving and they need food, but they can't get food because it's easy to dump it in the garbage because we buy fast food and food has been cooked at home. And it's something we need to look at, and it's something that we need to look in Trinidad and Tobago, what first world countries doing, Madam Speaker. It's time we look at food banks and food cooperatives and ways that we can actually help do soup kitchens and save that food. It's a sin to throw away good food. Our storage facilities are often outdated and inadequate. leading to significant losses of perishable goods and reducing our capacity to take advantage of favorable market conditions. To promote the growth of our agricultural sector and ensuring food security, it is imperative that we prioritize investments in modernizing and expanding our agricultural infrastructure. By doing so, Madam Speaker, we empower our farmers, enhance their livelihoods, and strengthen our nation's agricultural resilience in the face of future challenges. The glaring absence of packing houses for agriculture is a pressing concern that demands immediate attention. I am deeply troubled by this issue. Packing houses are vital components of agricultural supply chain, yet they are sorely lacking in our country, undermining the efficiency and competitiveness of our farming sector. It is high time we prioritize the establishment of well-equipped and accessible packing houses across our agricultural regions. Madam Speaker, I wonder if this government recognizes the invaluable contributions that my agriculture-dependent constituency makes to this economy. If so, why are the youth of Cumuto Manzanilla not to be assisted by the initiative to become successful entrepreneurs? Did you know that the farmers right now in my constituency, 35 as I said, started with 400. So when the rains come, we hope there is going to be more, but they're still waiting for the money. Local government. Madam Speaker, many roads are and have been dilapidated for years under this administration. Some main roads, some secondary roads. Many roads that lead into rural communities give access to tax-paying citizens to their homes left unattended for years without any forms of rehabilitation by this administration. Madam Speaker, the allocation to Ministry of Rural Development and Local Government, which is 1.887 billion, is very insufficient. Madam Speaker, I'm in constant contact with the chairman of the San Grande Regional Corporation, as my constituency falls within this region, and I feel for the chairman, as many of the roads that are in need of repairs falls within the jurisdiction of the corporation. And due to the lack of funding from the central government, they lack the resources to repair roads that fall under their purview. Therefore, I call on this government to release the necessary funds for the San Grande Regional Corporation. Clearly, Madam Speaker, this is what you call spite and vindictiveness. Madam Speaker, the Minister of Finance stated that a new state company to deal with secondary road rehabilitation and improvement company limited. Madam Speaker, I listened to the minister call out areas that will benefit from this program, not an area in Cumuto Manzanilla was mentioned. So I want to know, will any of this money be spent in Cumuto Manzanilla? I will continue my works here in Cumuto Manzanilla. Again, Madam Speaker, the constituency has been neglected by the Rowley-led PNM government since it took office in 2015, and this shows the continued neglect for rural communities. I have listened to the cries of the people of the constituency, and I feel for them. That is why I say that I am here to support you, I am here to listen to your cries. Madam Speaker, it's difficult to comprehend that the Minister of Works has roots in the area and would have a greater appreciation for the woes being suffered by residents of this area, with a view to bringing equal relief to residents. But rural neglect has no place in a government that starves the San Grande Regional Corporation for funding only because it's controlled and administered by the UNC. Madam Speaker, roads such as Kaiwal Road, St. Mary Manuel Road, Guatapahara Road, Kunapa Sonad Main Road, Pramita Main Road, Salmadi Road are in serious need of repairs, and every day I'm bombarded with calls and visits from constituents. The neglect is seen in huge gaping potholes straddling many roads, some spanning the entire roadway, particularly where water lines have been laid, and many of these water lines during landslips has been ruptured. Penalties for overweight trucks needs to be done, because whatever roadway get repaired, when these trucks pass, they destroy the edges of the road, and that's it. No more road repair for a very long while, and the people suffer damage to their vehicles and whatnot. Madam Speaker, it seems the minister has forgotten to mention that it has not been the current state of our nation's road, In the constituency of Cumuto, Manzanilla, roads are totally affected by this, and I would expect that is enforced since last year, but nothing. I want to let the government know just recently the residents of North Oropuch staged a massive protest due to conditions of the roads, because there is a bridge that was done, a road was done, but right now it's up in arms. Madam Speaker, I hear the Minister talking about connectivity to the provider to the nation. Cumuto Manzanilla needs internet. During the COVID-19, many of our children could not access internet
Honourable
service.
Member, your ordinary time is now expired. You're entitled to 10 more minutes to complete your presentation if you wish.
I wish. Thank you
Please
very much.
proceed.
Madam Speaker, rural neglect continues with education in my constituency. In the last budget, I raised concerns about the non-opening of Sangre Chiquito Presbyterian School, which has been closed for close to 3 years. Just to educate everyone in this House, Honorable House, that school, 130 years old. And these children are housed at Grosvenor Presbyterian School. First was the Beach High School, now, well, Sangre Chiquito Presbyterian School. I understand there are issues with the ECCE at coal mine, and I'm praying and hoping that in 2024 that's dealt with, because that's a very poor community, and many of the parents have no way to send their children. They cannot afford to send their children to preschool. Madam Speaker, I also want to make a plea to the Minister of Education. Humbly, I'm asking, as I asked in the other budget presentation, the Islamic community are hoping that they will get a school in that area of Trinidad. I think we are represented by all denominations in Cumuto, Manzanilla. But to my Muslim brothers and sisters, I will continue to fight and continue making the representation. I turn to the proposed school supplies and book grants of the 1,000 to assist me in the course attendance at primary, secondary schools. The only way you can get that is a means test, but I think the whole of Cumuto and Manzanilla would actually qualify for such. And I just hope that they will get the book grants. Madam Speaker, I want to shout out to the Minister of Public Utilities in terms of the electric lights, the street lights. Many of the areas where farmers have to access, there are no lights. So there are two things that will happen. They have no lights to get to the farms, and they have no lights to take the produce out. And because of that, they meet up a lot of bandits. So I'm asking if those areas, the agricultural areas, we could have street lights. I'm also asking the Minister of Public Utilities. We have a filling bay for water trucking in Turi by National Quarries. I'm asking if there could be another one at another destination, because the water trucks takes a long time to get filled, and by the time they reach the destination, with a large geography between fishing pond and beach, half the water gone from the truck. Madam Speaker, property tax is another matter which has been raised in my constituency. They're wondering, with rural communities where people don't pay, where there are not a lot of people, how are they going to get some equity in terms of road infrastructure? Madam Speaker, the government is coming with scare tactics to get the people to submit to them. I don't know. The constituents of Cumuto Manzanilla say no to property tax. However, what is important that they need to be heard, and nobody has come to them yet. Madam Speaker, constituents of Cumuto Manzanilla have been clamoring for a better transport system. The PTSC buses are needed more than ever. People don't have money for transport. So in many instances, they keep the children home. They don't send them to school. So they work in the garden with some of their parents are gardeners, or they work for people with gardens. So right now, many of the areas don't have buses. The reason being, there are too many landslips. So these people are basically cut off. The elderly of the constituency that also need a bus service, and I remember during the People's Partnership government with the Ministry of the People, there was the use of the Eldamo buses for the elderly and even persons with special needs. This needs to be revisited in many areas of Cumuto Manzanilla. I turn to community centers. Madam Speaker, in the constituency of Cumuto, Manzanilla, there are 10 community centers. 3 of these centers are in deplorable shape, such as Sangre Chiquito, La Tosca, and Nestor. I want to invite the Minister of Community Development to visit these centers and hope that something can be done in the near future. Cumuto, Manzanilla is excellent for ecotourism. We have the New River Swamp, we have the Bat Cave, we have the beach forest, the growing stone, and we have many other areas. We all remember fondly in November, we had the major floods, 2022, and what happened to the Manzanilla breakaway. Now, what we had in April of this year, 2023, is when we all saw the Porsche Cayenne floating in flooded waters. There was no disaster management. There was no ODPM. All it was God sending a high-up truck to rescue 3 human lives. They were American citizens, and thankfully they were rescued. It was myself and my staff. I want to say it's time the disaster management unit be upgraded in Sangre Grande, and because the ODPM is so far, and many of the areas in the Eastern Peninsula from Matla coming right down, they may be isolated maroon. People can't access services. You may want to consider now having a satellite area for ODPM. Just a suggestion. And before I close, as we look at opening the new Sangre Grande Hospital, I am making a plea for a Beach Health Center, which is 25 minutes from Rio Claro Health Center and 40 minutes to Sangre Grande Hospital, if they can have extended hours and also ambulance bay like they have up in Toco Sangre Grande. It was under the partnership our health centers open for 24 hours, for time for us to look at extended hours. So if we focus on primary health care, Madam Speaker, we could prevent the budget from escalating so high so that they end up in hospital being blind, need dialysis, need heart surgery. So, Madam Speaker, I conclude by saying and agreeing with the leader of the opposition that this budget offers no hope to the people of Trinidad and Tobago. And I say to the people of Trinidad and Tobago, especially the people of Cumuto, Manzanilla, stand firm, stand fast. The UNC will return and good governance shall return. Madam Speaker, with these few words, I thank you. God bless.